Good afternoon, and welcome to the South Florida Hospital News and Healthcare Report CEO and Leadership video series. This video will be part of our continuing series of CEOs and leadership conversations with the people of South Florida. With us today is Vicky Sabharwal from Jackson Behavioral Health Hospital, and that's part of the Jackson Memorial Healthcare System. And Vicky, welcome, and thank you for taking time out of your day to visit with us today. And welcome to our show.
Thank you for having me.
Vicky, tell us your position with the Behavioral Center.
So currently, I am the interim CEO for the Jackson Behavioral Health Hospital. We are the largest freestanding psychiatric hospital in Florida. I'm also the CFO and the COO. So I've been with behavioral health at Jackson for the last 4 years, starting off with CFO and COO, and I just recently took on interim CEO about 2 months ago.
So tell us a little bit about your family background.
Sure. So I'm of Indian descent. I was born in England. I came to the States when I was 4. I lived in Canada for about 10 months, grew up in New Jersey, and slowly made my way down south to Miami. So I moved
Nice.
in Miami for almost 10 years now.
What about education-wise? What did it take to get to where you are today?
I did my undergrad at Barnard College in New York City. It's the sister school of Columbia University. I did my Bachelor in Arts. I graduated in 2002. And then I did my master's in healthcare administration from FIU, and I graduated in 2014. So I have an MBA.
So what got you into the financial end of the business too?
So actually, I didn't start off financially. I actually started working at a pharmacy benefit management company. It was a corporate division focusing more on business operations and requirements. I was there for 9.5 years, and I thought I would retire. I thought I would be a lifer at that company. It was a great company to work for. They got bought out, and my department was one of the departments that was, reduced, and I was let go. I also happened to be getting married, and I thought, okay, I need to apply for jobs. I'm moving to Miami. I started looking around, and I saw a finance analyst position at Jackson Memorial Hospital, and I went for it, and I took a chance, and I got the position.
What were some of the major challenges during your journey?
Trusting in myself. I think when I graduated, when you're young, you do your best, you work hard, and I really loved the company that I used to be at. And it was that change. Change is one of the hardest things anybody can pursue. And I took the chance of coming down and working for Jackson, and I'm so glad I did. It probably was one of the best decisions I made, but there were challenges along the way, because working in a hospital setting when you're coming from a corporate world is very different. It's very fast paced here. It's it's constantly changing, right? You think you're coming in one day doing one thing, and you end up doing something completely different. And that's the challenge, and that's what's so great about it.
So what does your typical day look like?
So because I'm in the interim role, CEO role, I still have finance and I still have operations. So, when a month closes, the first week of any month, it's all about the month-end financials. It's about reviewing that. On the operations standpoint, it's managing bed capacity, it's managing supplies, ensuring that we have everything we need. I can look at my calendar one day and say, like, oh, okay, it's a very light day in meetings, and it ends up being one of the most busiest days I have. So every day is different. I would say a typical day, there is no typical day.
As far as the COVID situation at the hospital, how is that affecting your physicians and also your staff? I think we had a lull for a period of time. Everybody was going, yeah, we got this covered. And then all of a sudden we're back again. So tell me a little bit about how you handled those ups and downs.
Absolutely. So in the beginning of the pandemic, everything was unknown. No one really knew much. We knew we had to move quickly. For behavioral health, for our outpatient services, we moved to telehealth, and it worked really well. As we started getting a little bit more aware and we had established processes, things got better. Of course, there's cycles, and Compared to medical, we don't have ICU beds. So when our patients, if they're COVID positive, that's their secondary diagnosis, right? They're here for mental health diagnosis. So these are patients that don't require any medical treatment. We just have to make sure that we remind them to wear their masks and, properly distance. But again, we kept a separate COVID unit. We were able to always manage with one COVID unit. With Omicron, we have not seen this before. We have we have 2 COVID units, the highest we've ever had. And it's, again, just the variant, it's very contagious. Our patient population sometimes, again, they're mental health patients. They don't always adhere to mask wearing. And so we have to do our best to remind our patients and also to socially distance and, during meals, separating patients so they don't eat together. So those are some of the things that we've had to implement this time around.
Tell us a little bit about the challenges that you ran into and some of the things that actually today are making things work better because of lessons learned through the 2 years of a pandemic.
Allowing telehealth services on outpatient. I think psychiatry is something where telehealth is okay. You can be in the comfort of your home on the sofa talking to a provider and feeling that it's that comfort level. So prior to the pandemic, we never offered telehealth services. We were talking about it. We were trying to partner with other providers to see how that happened, but we never really implemented telehealth. The start of the pandemic in March, April, May of 2020, probably like 80+% of our outpatient volume moved to telehealth. Now, of course, there's patients that want to come in person, and that is totally okay. But I would say even today, I would venture to guess at least over 50% has moved to telehealth.
Who are your mentors? Who could you look back and say, yeah, that's the person that got me into this stuff? Or
Mark Knight. Mark Knight. And he knows it. Yeah, he guided me throughout this whole journey here at Jackson Health System. When I was promoted to a director of finance for ambulatory, he was the one I always can bounce ideas for. I pick his brain. Even I was 6 months pregnant when I took the CFO of behavioral health job on. That doesn't usually happen. And I said, Mark, I'm 6 months pregnant. Are you sure I can handle this? He goes, I know you can handle it. And that just gave me the confidence that I needed. And even in my current role as interim CEO, I have a lot of great mentors over the years, but Mark is someone I always talk to.
What one piece of advice could you give somebody as a excel in their career to help them out?
I think going in, so healthcare is very dynamic and it's always transforming, right? There's so many rules, so many aspects to healthcare. So if healthcare is something that anyone wants to actually pursue, stick with it and don't doubt yourself. It's change. I started in corporate and I ended up in finance to now being CFO, CEO, and interim CEO. It's trusting yourself and just understanding and allowing the different changes. Change is good. I think it's hard for a lot of people when change happens, but sometimes change is for the better.
What keeps you up at night? Is it, the operations, what's going on in the world today? What kind of keeps you up at night as CEO? Not personally, but as CEO.
We've always had patients come in, but now with the pandemic, I think it adds additional stress and anxiety that may not have been present prior. Mm-hmm. So it's just the population that's coming in. And we've seen an increase. And I think that's what keeps me up is our ability to handle the volume, managing COVID versus non-COVID patients, because we have seen an increase in the number of COVID patients, which we've not had to handle prior.
Are you seeing the patients that have COVID less sick than before or about the same?
For us, the practice has always been if a patient comes here, they're COVID positive, but they're not medically sound, we would always transfer them over to our sister facility. Okay. Just because we are not a medical facility, we are purely behavioral health.
Okay.
So from that aspect, they have to be medically cleared. Now, in terms of acuity with their mental health, it varies. We've seen a lot more acute psychotic patients come through.
because of the COVID situation.
I think it's a
Or-
mix of everything. Yeah.
Okay. Well, again, I appreciate your time, and I truly want to thank you for taking the time to meet with us today, Vicky. And I know you have a busy day. In fact, I'm not sure which hat you're putting on, after lunch, but I'm sure you'll wear it well. So with
Thank
that, I want to say again, thank you. And this is Charles Felix from South Florida Hospital News and Healthcare Report, and we'll see you next time.